41. What is the priority nursing action for a patient with TB and a sputum culture resistant to isoniazid and rifampin? Answer: notify the provider and initiate MDR-TB treatment. Rationale: resistance to isoniazid and rifampin defines MDR-TB, requiring specialized therapy, per CDC MDR-TB guidelines. 42. What should the nurse teach a patient about TB airborne precautions at home? Answer: sleep in a separate room and ventilate the home. Rationale: isolation and ventilation reduce household transmission, per CDC infection control guidelines. 43. What is the nurse's first action for a patient with TB developing hearing loss on streptomycin? Answer: stop streptomycin and notify the provider immediately. Rationale: streptomycin causes ototoxicity, risking permanent hearing loss. Stopping the drug and notification prevent harm, per WHO MDR-TB guidelines. 44. What should the nurse do for a patient with latent TB and a history of alcoholism? Answer: monitor liver function and provide alcohol cessation resources. Rationale: alcoholism increases hepatotoxicity risk during TB treatment. Monitoring and resources ensure safety, per CDC latent TB guidelines. 45. What is the priority nursing action for a patient with TB and a new pleural effusion on chest X-ray? Answer: notify the provider and prepare for thoracentesis. Rationale: pleural effusion may indicate TB progression. Notification and thoracentesis guide treatment, per CDC diagnostic guidelines. 46. What should the nurse monitor in a patient receiving rifabutin for TB? Answer: monitor for hepatotoxicity and uveitis. Rationale: rifabutin risks liver damage and eye inflammation. Monitoring prevents complications, per WHO TB treatment guidelines. 47. What is the nurse's first action for a patient with TB reporting fatigue? Answer: assess for anemia and notify the provider. Rationale: fatigue may indicate TB progression or drug-induced anemia. Assessment and notification guide treatment, per CDC clinical guidelines. 48. What should the nurse do for a patient with TB and a language barrier? Answer: arrange for a certified medical interpreter. Rationale: accurate communication ensures understanding of treatment, per CDC patient education guidelines. 49. What is the priority nursing action for a patient with TB and a new onset of neck stiffness? Answer: notify the provider and prepare for lumbar puncture. Rationale: neck stiffness suggests TB meningitis, requiring urgent diagnosis by a lumbar puncture, per CDC clinical guidelines. 50. What should the nurse teach a patient about TB sputum collection? Answer: collect early morning sputum in a sterile container. Rationale: morning sputum has higher bacterial yield, improving diagnostic accuracy, per CDC diagnostic guidelines. 51. What is the nurse's first action for a patient with TB developing elevated liver enzymes on isoniazid? Answer: stop isoniazid and notify the provider immediately. Rationale: elevated liver enzymes indicate hepatotoxicity, requiring drug cessation and provider evaluation, per WHO TB treatment guidelines. 52. What should the nurse do for a patient with TB who is pregnant? Answer: consult the provider and monitor for drug safety. Rationale: pregnancy affects TB treatment choices. Consultation ensures fetal and maternal safety, per CDC TB guidelines. 53. What is the priority nursing action for a patient with TB and a positive sputum smear after 3 months of treatment? Answer: notify the provider and assess for drug resistance. Rationale: persistent positive smears suggest treatment failure or resistance, requiring evaluation, per CDC treatment guidelines. 54. What should the nurse monitor in a patient receiving levofloxacin for MDR-TB? Answer: monitor for QT prolongation and tendinitis. Rationale: levofloxacin risks cardiac and musculoskeletal complications. Monitoring prevents harm, per WHO MDR-TB guidelines. 55. What is the nurse's first action for a patient with TB reporting weight loss despite treatment? Answer: assess nutritional status and notify the provider. Rationale: weight loss may indicate treatment failure or malnutrition. Assessment and notification guide care, per CDC clinical guidelines. 56. What should the nurse do for a patient with TB and a history of drug use? Answer: screen for hepatitis and arrange DOT. Rationale: drug use increases hepatitis risk, complicating TB treatment. DOT ensures adherence, per CDC public health guidelines. 57. What is the priority nursing action for a patient with TB and a new onset of seizures? Answer: administer prescribed anti-seizure medication and notify the provider. Rationale: seizures may indicate TB meningitis or drug toxicity. Medication and notification manage symptoms, per CDC clinical guidelines. 58. What should the nurse teach a patient about TB follow-up care? Answer: attend regular clinic visits and complete sputum testing. Rationale: follow-up monitors treatment response and prevents relapse, per CDC TB treatment guidelines. 59. What is the nurse's first action for a patient with TB developing joint pain on pyrazinamide? Answer: notify the provider and assess for gout. Rationale: pyrazinamide causes hyperuricemia, leading to gout. Notification and assessment guide treatment, per WHO TB treatment guidelines. 60. What should the nurse do for a patient with TB in a correctional facility? Answer: coordinate with public health for testing and DOT. Rationale: correctional facilities increase TB risk. Coordination ensures treatment and containment, per CDC public health guidelines. 61. What is the priority nursing action for a patient with TB and a new onset of cough? Answer: assess cough characteristics and notify the provider. Rationale: a new cough may indicate TB progression or reinfection. Assessment and notification guide treatment, per CDC clinical guidelines. 62. What should the nurse monitor in a patient receiving bedaquiline for MDR-TB? Answer: monitor for QT prolongation and hepatotoxicity. Rationale: bedaquiline risks cardiac and liver complications. Monitoring prevents harm, per WHO MDR-TB guidelines. 63. What is the nurse's first action for a patient with TB showing hilar lymphadenopathy on chest X-ray? Answer: notify the provider and maintain airborne isolation. Rationale: hilar lymphadenopathy suggests active TB, increasing transmission risk. Isolation and notification ensure safety, per CDC diagnostic guidelines. 64. What should the nurse do for a patient with TB and a history of smoking? Answer: provide smoking cessation resources and monitor respiratory status. Rationale: smoking worsens TB outcomes. Cessation and monitoring improve recovery, per CDC TB guidelines. 65. What is the priority nursing action for a patient with TB and a new onset of hematuria? Answer: notify the provider and assess for drug toxicity. Rationale: hematuria may indicate rifampin or other drug toxicity. Notification and assessment guide treatment, per WHO TB treatment guidelines. 66. What should the nurse teach a patient about TB medication side effects? Answer: report yellowing of the skin or vision changes immediately. Rationale: these symptoms indicate hepatotoxicity or optic neuritis, requiring urgent evaluation, per CDC TB treatment guidelines. 67. What is the nurse's first action for a patient with TB developing respiratory distress? Answer: administer oxygen and notify the provider immediately. Rationale: respiratory distress may indicate severe TB or complications. Oxygen and notification ensure rapid intervention, per CDC clinical guidelines. 68. What should the nurse do for a patient with TB and a history of malnutrition? Answer: refer to a dietitian and monitor weight gain. Rationale: malnutrition worsens TB outcomes. Nutritional support and monitoring improve recovery, per CDC TB guidelines. 69. What is the priority nursing action for a patient with TB and a new onset of headache? Answer: assess neurological status and notify the provider. Rationale: headache may indicate TB meningitis or drug toxicity. Assessment and notification guide diagnosis, per CDC clinical guidelines. 70. What should the nurse monitor in a patient receiving cycloserine for MDR-TB? Answer: monitor for neurological side effects and seizures. Rationale: cycloserine risks CNS toxicity, including seizures. Monitoring prevents complications, per WHO and DRTB guidelines. 71. What is the nurse's first action for a patient with TB and a positive sputum culture after 4 months of treatment? Answer: notify the provider and evaluate for MDR-TB. Rationale: persistent positive cultures suggest treatment failure or resistance, requiring specialized evaluation, per CDC treatment guidelines. 72. What should the nurse do for a patient with TB who is a recent immigrant? Answer: screen for TB exposure and coordinate with public health. Rationale: immigrants from high-prevalence areas are at risk. Screening and coordination prevent spread, per CDC public health guidelines. 73. What is the priority nursing action for a patient with TB and a new onset of skin rash? Answer: stop suspected medications and notify the provider. Rationale: a rash may indicate drug hypersensitivity, requiring immediate cessation and evaluation, per WHO TB treatment guidelines. 74. What should the nurse teach a patient about TB infection control in public? Answer: avoid crowded places and wear a mask. Rationale: crowded settings increase transmission risk. Masks reduce spread, per CDC infection control guidelines. 75. What is the nurse's first action for a patient with TB developing tinnitus on streptomycin? Answer: stop streptomycin and notify the provider immediately. Rationale: tinnitus indicates ototoxicity, risking permanent hearing loss. Stopping the drug and notification prevent harm, per WHO and DRTB guidelines. 76. What should the nurse do for a patient with TB and a history of mental health issues? Answer: monitor for psychiatric side effects and refer to mental health services. Rationale: TB medications like cycloserine can worsen mental health. Monitoring and referral ensure safety, per CDC TB guidelines. 77. What is the priority nursing action for a patient with TB and a new onset of abdominal pain? Answer: assess the pain and notify the provider. Rationale: abdominal pain may indicate hepatotoxicity or TB dissemination. Assessment and notification guide treatment, per CDC clinical guidelines. 78. What should the nurse monitor in a patient receiving moxifloxacin for MDR-TB? Answer: monitor for QT prolongation and hepatotoxicity. Rationale: moxifloxacin risks cardiac and liver complications. Monitoring prevents harm, per WHO MDR-TB guidelines. 79. What is the nurse's first action for a patient with TB showing pleural thickening on chest X-ray? Answer: notify the provider and maintain airborne isolation. Rationale: pleural thickening suggests active TB, increasing transmission risk. Isolation and notification ensure safety, per CDC diagnostic guidelines. 80. What should the nurse do for a patient with TB and a history of renal disease? Answer: monitor renal function and adjust medication doses. Rationale: renal disease affects drug clearance, increasing toxicity risk. Monitoring ensures safety, per CDC TB guidelines.